Heron's Cove is a crisis center here at Chesapeake Integrated Behavioral Health Care, where anybody who's experiencing a behavioral health crisis can walk in regardless of the time of day. You don't need an appointment to get immediate access to care. And essentially our goal is to stabilize people at the least restrictive level. So we don't want people to end up in a hospital if we can stabilize them here and send them home to their support system and keep them in the community where they're going to be the most comfortable.
And the facility is a 23-hour facility where anyone who is experiencing a crisis, whether themselves or perhaps a family member, they can bring that family member here and they can come and receive services relating to mental health. Officers on the street, they identify someone in crisis, instead of maybe taking them to a local hospital under a custody order, can bring them here where they can receive much better and more robust services.
Individuals come in, they'll get to see a nurse practitioner and potentially have medications if that's appropriate. They'll see a registered nurse or an LPN where we'll get kind of a medical assessment, make sure everything looks good in that way. They'll see licensed clinicians so we can do an assessment and figure out what's going on with this individual and what do they need to stabilize today. And then from there, we can do a whole host of things. We can do creative interventions. We can do skill building to help de-escalate crisis. We can do peer support. So we have an individual with lived experience who can use their lived experience to comfort and support and help guide individual through, the crisis that they're currently experiencing. And a big piece of what we do is care coordination. So we want people to leave with a plan for how will you continue care when you leave us, because it's not enough for us to stabilize you. You need to be able to maintain, and a big piece of that is where do you go from here?
It gives me great satisfaction to work here. I like to be able to see the change in the client from just the time when they walk into the door, from the time that they leave. You can see that they may feel either more comfortable, a lot safer. They may not be feeling the same way they felt when they came in. And to me, that is a big step in their journey during the time someone's going through a crisis. And I feel as every client that has actually come here, we've seen a change.
I come here one day in a real bad day, in the middle of the night, nowhere to go, freezing cold, stuck hungry, with nothing. You know what I mean? They fed me, they gave me a shower, they protected me.
It definitely feels amazing to know that we've taken a person who has come in at their most vulnerable, right? Because that's really what we're seeing is people come in and they are in a state where their current situation has exceeded their ability to cope and manage it. And they know that they need help, but maybe they don't know what they need. And we can say, hey, let me just give you some education. Did you know that this is common with this type of diagnosis? And here's hope. So we want people to know that it is possible to get better and that people do get better all the time with both mental health and substance use. So we really want to instill that bit of hope, and it feels really good to be part of that.
This facility here has really revolutionized what it is that my team is able to do, which is not take somebody against their will, but bring them here because they want to get help, to educate them on how they can get help. And then through Heron's Cove, the continuity can go into CIBH to long-term care. It will keep them from needing the police's response because they know that this resource exists.
Places like this is helping to close the gap. We're saying, hey, rather than having to wait to be seen and potentially get worse or to go into a higher level of care, here is a place where you can come and get immediate access to what you need right now. It really keeps people from ending up at a higher level than what they really need, and it prevents them from waiting to get in somewhere and potentially getting worse while they're waiting to be seen.
If it's you, please come, allow us to care for you. Give us the opportunity to create an opportunity for you to have a long life full of joy, love, and just peace of mind.
If I could say anything to all of them, I love you with all my heart. Thank you for saving my life. God bless you, and please continue to do the best things always.